Welcome everyone. I'm Councillor Matthew Winnington, Cabinet Member for Community Wellbeing, Health and Care. If the continuous fire alarm sounds, please evacuate the room and public gallery. There's no public gallery. By the stairwells, do not attempt to use lifts. Please assemble by Queen Victoria's statue in Guildhall Square. No one signed in, there's no press or public. Please can everyone use the microphones and remember to switch them off when they're finished. Just start with the introductions then. Start to my left.
Anna Martin, Democratic Services.
Andy Biddle, Director of Adult Social Care.
Emma Baxter, Adult Social Care Finance Manager.
Councillor Graham Heaney, Labour Group Spokesman for Community Wellbeing, Health and Care.
Thank you very much. Don't have any deputation requests. Any apologies for absence? No apologies for absence, thank you. Graham, any declarations of interest? And I don't have either. So we swiftly move on to item 3. Adult Social Care Annual Complaints Reports 2024-2025. Over to you, Andy.
Thank you. Firstly, my thanks to John Thomas, who's the Complaints Manager at Adult Social Care, for drafting the report. The Adult Social Care Strategy sets out how the service will work with our residents and the outcomes that we aim to achieve around personalised and effective care and support. And this report is one of the ways that we ensure accountability through understanding residents' views of the service through complaints and compliments. So under section 3 of the report, that section sets out the numbers of complaints and contacts and shows the areas and reasons for complaints. In section 4, we have the performance of the service in answering complaints and the actions taken to maintain and improve answering times. Section 5 highlights the reduction in local government ombudsman referrals for the period. And in sections 6 and 7, we've set out the advocacy arrangements for complainants and the percentages of upheld complaints within the year. In section 8, as discussed in previous years, Adult Social Care have been encouraging colleagues to notify the Complaints and Compliments Manager when they receive a compliment. And that section includes a few examples of compliments with a more extensive record as an appendix to the report, Appendix 1. I draw the attention to 2 of the compliments in the index, which are particularly indicative of the service people have received. The first is the support offered by Harry Sotnick House, which was seen as outstanding and exceptional by one of our residents and their family. And the second was the impact of the cross-cultural women's group for another of our residents. In sections 9 and 10, we detail the persistent complaints policy, which we haven't had to use this year, and also the councillor and MP's inquiries that we receive. I'm always shocked it feels a lower number. I always feel I receive more than that. But we categorise them individually. So we set those out, and they tend to have a reply. Whilst we don't put the numbers, they tend to reply to relatively swiftly as well. In section 11, we set out how we learn from complaints, with a number of examples in the main body of the report and more extensive examples in an appendix, Appendix 2. And I draw attention to the first learning from complaint in Appendix 2, really because it shows that a single complaint can have numerous pieces of learning from it, and then impacts on the service that we provide in the future. Sections 12 and 13 detail the separate arrangements for complaints related to integrated services. As you know, we provide services in conjunction with our NHS colleagues, and also lifts out there the training offer for colleagues from the Complaints Manager. So that's a summary of the report. Happy to take any questions.
Thank you very much, Andy. Just before I come to Graham, just to thank John and his team for putting this together and the work they do. Having done complaints myself in a statutory organisation before, I know that dealing with them in a professional and proper manner is extremely important, and also learning from them is also a very important part of the role. Graham.
It's more a couple of observations, really. I noticed that when we talk about the location for complaints, in fact, community social work comes up with the largest single number. But also, when you look at compliments, that also has the largest single number. So there's an interesting sort of dynamic going on there, that it gets a lot of complaints, but it also gets a lot of compliments. And I suppose the other one that sort of struck me when I was looking at the figures, again, it's the actual number of complaints. The two areas that have the largest number are staff communication and inadequate service. Now, I'm assuming because of the result of the complaints process, we don't actually find that there are a lot of examples of inadequate service or necessarily poor staff communication, but it seems to be one of those issues where maybe people's understanding and expectations of what they will get are maybe not as it actually is. And secondly, I suppose when you're talking to someone about what they're facing or what they need to do, maybe they don't quite understand or hear what's really being said, and the issue may be about misunderstanding rather than people not communicating properly. But those are my sort of two observations.
Thank you, Graham. Andy, do you want to come back on any of that?
Thank you. I think that's true. I've said it before, and I think it's still true, that oftentimes our residents will come to adult social care at times of crisis. And I have faith that most of our staff make every effort to explain in really accessible terms about the process and procedures, but it's still quite complicated. I think we often see that with the NHS as well. You don't need it until you need it, and then you don't necessarily have knowledge around it. I think there's always things that we can do to improve our communication. We did, for instance, review our written leaflets that we give out last year. For accessible language, we're looking at our website at the moment and thinking about what kind of language we use. So even if we don't uphold a complaint and we don't think that it was justified necessarily, there's still learning that we can take about continuing to strive to make things accessible, because people have a very different interaction with the spoken word and the written word. And I think that there's an accountability on us, if you like, to continually try and improve how we put things across.
Thanks, Anthony, and thanks, Graham, for your comments. I'd just like to, I think we've got we have a very consistent number of complaints that come in. Always like to see it lower if we could, but I think having a consistency, especially with lots of things going on in people's lives, and I do think that I would draw the attention to the fact that only 2 of the complaints went to Ombudsman this year, as opposed to 3 the year before, which is also a very low number anyway. But I think I commented last year, and I think the year before that as well, that is actually a testament to our complaints team, because that means that people consider, even if they're not upheld, that people consider that they've been listened to and it's been explained and things have gone through in a proper way. The reason why people go to the next level is where they're not happy, where they don't think we've done what we could do. And so therefore, again, I think that is a testament to our complaints team, but also to what happens when the complaint comes in, because it's how well and thoroughly it's looked into. Because, as I say, I know I haven't been a complaints officer myself. When you get a complaint, making sure that you have everything from the team that it is connected to actually able to give that response professionally and clearly is actually a way that we can, it shows that things have been done properly. The Appendix 2 is really important about our learning, and as Andy said, the learning that we get even when we don't uphold a complaint, about maybe not get to the stage of them feeling like they have to have a complaint, have a conversation, is there things we can communicate better, and whatever. So, but by and large, this is an excellent report. And of course, I'm going to come back at the end, because it's something I've been pushing for years, which is about recording these compliments. And actually, I just have a request. Next year, could we call it the Complaints and Compliments report? Because I think it is a really clear thing, and we should never underestimate what compliments mean. They should be recorded because they are heartfelt. People don't give compliments just for the sake of it, especially not when it's in social care. When they say it, they mean it, and that's what we should be really taking on board. And I'm really proud that we have got this many compliments, because that is a testament to all our excellent staff that work in adult social care. And it's also good for them to be able to not just think it's an aside or anything. It's something that people have taken time to. If someone gives you a compliment, they mean it, and they've taken the time to do it. So I'm really pleased that we've had such a massive jump in recorded compliments. I'm sure there are even more out there that are still not being recorded. So always again encourage any of the staff, but that does go to show the incredibly hard work, and we know that this kind of stuff then going back to when we're discussing this with staff, we can put this in the newsletter which goes out to staff, and that really gives a boost. So even if people may not have had, maybe they're in a position where they're not in one where they have face-to-face contact or whatever, they see their colleagues getting compliments, it means that they feel a little less hard done by, which in social work can often be the case, because it is a tough environment, and especially at the moment where there's been such a squeeze on money and demands are going up and caseloads are going up and all that kind of thing. I think there's a double thing here then. Our complaints are being kept pretty steady, which is positive. It'd be great if they were even lower, but they're also being dealt with professionally, and I'm really encouraged to see the learning as well, because that is really key. But I'm also really pleased to see the compliments here in black and white, and Appendix 1, so anyone who's watching this now or wants to see it afterwards, Appendix 1 has got examples of compliments, lots and lots of examples. Lots of them are one line, some of them paragraphs, but they are really, really critical, because it really shows the incredibly hard work that our teams do across adult social care. And as from the administration, lived out administration, I'm really, really proud of our team, and I'm sure from Graham from his group as well, about that, how proud we are of that work, and that they are being recognised. And it's one of our opportunities to recognise the work they do, because it's in black and white, and this is the voices of the people of this city, giving their opinion and giving their thanks. So that's always great to see. So thank you very much for this. Happy to note the report, and looking forward to even more compliments next year, and hopefully a few less complaints. But please do pass on all of our thanks, I think, from all the members of the council to John and his team, but also all of the adult social care team, because we know what a fantastic job they do, and it's good to see some of them are getting a bit more recognition this year through actually recording those compliments. Okay, so agenda item number 4, adult social care prevention strategy. Back to you, Andy.
Thank you. So my thanks to Sharon Furtado and Charlotte Wilkinson for drafting the report. Under section 4, one of the outcomes that the adult social care strategy seeks to achieve for Portsmouth residents is access to preventative support to optimise their health and wellbeing. This report aims to provide members with information about how the service plans to achieve that outcome through our prevention strategy. Section 4 also sets out some of the other drivers for working preventatively in Portsmouth. So under section 5.1 sets out the ambition to have a more digitally friendly service. Whilst one of the areas of value for our residents is being able to speak to a person on the end of the phone, which we maintain, there are others who would be able to make use of digital information, and our aim is to support more opportunities for that to happen. Section 5.1.2 details the work on supporting our city's unpaid carers. We maintain, as you know, a carers service in the city, and we identify more and more carers each year and aim to support people to continue with their caring, but give them the support they need on a daily basis. Section 5.1.3 highlights the work to embed strengths-based practice across adult social care, focused on training, practice and policy. And section 5.1.4 shows the work to expand the number of residents who can access the community reopenment service and the change into diverting resources and staff capacity into the community from current bedded services. Section 5.1.5 highlights the positive changes in wait times for residents who need support with their mental health and support available whilst people are waiting to be seen in conjunction with their mental health. And section 5.1.6 shows the steps being taken to encourage the take-up of direct payments, an area where adult social care needs to improve its performance and will doubtless be the subject of some of our conversations with the Care Quality Commission when they come to inspect us on October the 7th. Section 5.1.7 highlights cross-council working on green spaces initiatives, and then in section 5.2 this highlights the knowledge of city resources and services and the principles of early intervention in services that we espouse and try and use for our residents. Section 5.3 highlights some of the risks in the use of digital carer support, information and guidance and prevention, and some of the work that adult social care is involved in to mitigate those risks. And finally, in section 6, the appendices contain more detailed information about how adult social care is working to maximise preventative opportunities for residents and embed an ethos of prevention in the practice of colleagues in Portsmouth. That's a summary of the report. Happy to take any questions.
Thank you, Andy. Great.
Yes, thank you. I mean, I think there's a lot of good interesting information here about how we're doing prevention, but I just want to ask one question about the mental health support progress. It talks about the positive changes attributed to a revised approach and enhanced staffing. Do we know if the revised approach involved something like a systems thinking approach to the processes of what they do or not?
In the main, it was a change in how that peer support is structured. We used to have it very much focused through what was Solent NHS Trust, and now we're thinking, well, we're activating actually a shared programme of support with a community group that meets in Southsea using facilities that are already established, and we think that's a more of a co-produced support offer. There's also the bit about in the report around reducing waiting times for our residents who have mental health support, and we've seen our colleagues in the Hampshire and Isle of Wight Foundation Trust recruit more clinician psychiatrists, which has helped us to do that.
I mean, I noticed the actual reduce of waiting times was pretty dramatic, because in July it was 14 weeks, but by August it was only 3, so that was pretty dramatic and obviously a very good news. And it looks like it says here that they've got long-term stability because of the recruitment of staff, and hopefully they will stay long enough to continue that.
We keep our fingers crossed, and I think I hope that the Trust recognises, and I'm sure they do, because it can be so difficult to recruit people at that level and with that level of expertise and clinical experience, that there's good staff support, there's good teamwork. I know I've been to visit our mental health services on a regular basis over the years, and it's certainly a welcoming environment, and I think that's really important for trying to maintain that stability of employment. So yes, hope so.
Thanks. I've just got a question for Emma. So obviously this is about prevention. Can you give a bit of an idea on what the difference, what sort of the investment we put into prevention, and what the alternative would be in terms of when we come across people that we haven't been involved with before, and what effect that can have on the finances?
I don't think I can specifically give you a figure for prevention, but what I can say is if we didn't do that preventative work, then there would obviously be more cost for us as adult social care, because they're more likely to be in a residential home or require further intervention. So I think that it does save us money by investing in preventative services.
So what we do every year is we put together a budget presentation when we're planning the budget for the next financial year, and we present that firstly to the Chief Financial Officer, the Section 151 Officer and the Chief Executive, and then we present it to the leader of the council. And we itemise our preventative spend, if you like, as part of the whole spend that adult social care makes. I think it's in the region of between 2 and 4%. But my memory may not be. We only presented it a couple of weeks ago, but so I can certainly dig those out, and I can provide that as an update for when we do the written minutes here. It sounds like a small amount, but I think with prevention, my experience is that the impact outweighs the amount that we're spending, if you like. So our independence and wellbeing team, our occupational therapy team, for example, our community reablement services, will all enable people to delay the time that they need to draw on more costly services, or potentially avoid having to draw on more costly services. And so I think that spend, that investment on prevention, I'll give you an example actually that we saw recently, in that we had one of our residents who'd experienced quite a significant stroke, had lost their house, their home, and had lost their job because of the change to their health. Within six to 8 weeks of work with that person, they were working on an allotment. They were working with some of our residents with a learning disability. They were proposing to start an access course, and they were seen as a really valued member of our volunteers, and hopefully will go on to get into some kind of paid employment. We'd see all that as preventative services, and whilst we're talking about a change for one person, that person won't be alone in those services that we've seen. In fact, some of our complements related to our independence and wellbeing and our community connectors. Equally, we have just employed, and I keep meeting James, so I'm really pleased to be able to name check him, a community connector for working in hospital, in our local hospital. His name is James, and he's already started to work with the staff in our emergency department to understand if people are unwell but don't need to be admitted, how we can connect them back into their communities. Maybe we can pull them out before they need to be admitted. So hopefully those examples show what we're trying to achieve with prevention, even if it's for quite a limited spend, that then avoids expenditure later on.
Thank you, Andy. Yeah, and I was, so for those watching who didn't see me limp in today with my stick, I had an experience at A&E a couple of weeks ago. And I did see the Community Connectors poster up, so I didn't know that they were actually in A&E, but that's really good, because I know from a professional point of view, when I used to be a support worker and I used to see them, they used to be out and about in the community, so actually having them in the emergency department is really good. It's a really good place to sort of capture people, and as you say, Andy, especially if they're regular attenders ED, that there might be other things that they can get involved with. Yeah, thanks both for that. Yeah, I think just wanted to sort of pull that out in terms of the investment in prevention and what a difference it makes. I know it's in the report as a general thing there, but I think that particular thing, and it's so wide ranging. So we've got digital accessibility, we've got strengths-based practice, we've got carer support, as Andy mentioned, we've got community reablement services, we've got improved mental health support, as Graham was mentioning, we've got micro-provision networks, which I know is a lot of work that we're putting into that, because that's an area where we need to improve. But also, and this is a really key thing, and this fits in with our health and wellbeing strategies, things like utilise green spaces. This is about environments. It's not about just, you know, care and sport. It's about creating those environments in the city as well, and really working across the board there. So I think that's really positive. And then obviously the achievements we've got, which I think is really positive as well. So the thing that comes through all of this, and this is where we've been working in the city for so long, is about partnership. So we work with partners to do this, because we can't do this on our own. As Andy just said, you can't, if community connectors aren't welcome into our hospital, into the ED, they wouldn't be there. If they weren't welcomed into community centres and other places, they wouldn't be there. They wouldn't be able to have the access. So this is about working together. But I do think it's important as well that we've registered the risks in here as well. About digital divide, which is something I have real concerns about nationally, where government and some local authorities increasingly go digital, and then they forget that people are actually, there's a lot of people out there for whatever reason find that either very difficult or in some cases impossible to use, and that forever thinking you can save money there. So it's about making sure that when we're doing this, prevention can mean sometimes the upfront cost might be a bit more, but actually the on cost, the savings, as you've been mentioning, are really important. And things like carer burnout, which is why our carer service is so important. And then also fragmented information, which again means closer working with our partners as close as possible, getting that trust in. And underutilisation of preventive services, and that's all about making sure that people know about them. It's no good having an amazing service if no one knows about it. I think we do quite a good job at that, but there's always things we can do to improve, because it's amazing sometimes you go to somewhere and the service we've been running for a long time, actually it's really well used, but then you go to someone and said, oh, I've never heard of that. And then the person that maybe they're working with, or the person themselves, has had all kinds of things and said, oh, I could have just gone here. So that's always something to strive to. So this is really important stuff. And this has always been something that we have prioritised at this city council. To be honest, whoever's been, over the last 20 years, whoever's been running it, it's always been a priority, and I'm really pleased to see this here. But I know that there is a lot more work to do, and especially as we said on the micro provision, because I think that's a particular area where we've been working on that. It's been a bit slow to get going, but that's something that we need to make sure we can do and encourage within our community in Portsmouth. So thanks for the report. Really, it's a really interesting report. Again, if anyone's watching at home or watching this on record, do have a read of this report, because I think it really does show how much work we do in this city on prevention, which actually saves not just the council, but the NHS and other bits of the statutory sector a lot of money. And we're investing in this, they're not, often, unfortunately, but also a lot of the time we are doing it in partnership. So we're doing that together, and we want to keep doing that in the city. So thank you for your report, and noted. So, item number 5, the exciting one, Andy. Client level data. Back to you.
Thank you. My thanks to John Hayter for drafting both this report and the next one in your pack. So I think this report, client level data, is to give a broad overview of the way that we're now reporting, and then the next report gives us a little more detail. So in section 2 of the report, one of the activities in our adult social care strategy is to improve delivery of our social care statutory functions. And one of the ways of understanding how we do this, or how we might go about this, is through the data and the performance information that we produce. Information can also support decision making and provide evidence of the right place to allocate resources. In section 4, we set out the establishment of client level data and the range of items that are required by the Department of Health and Social Care that we report to. And in section 5, we've got some more detail around some of the challenges with data collection and interpretation. In section 6, we provide some examples of the data that's reported on and how this can inform how adult social care is performing and the impact on our residents. As an example of this, the numbers of people who receive care and support in their own home as compared to those who need support in a care home environment, and the growth in older people in need of care and support in our city. And that then guides how we think about planning services in future years. So section 7 draws this together. The report's intended to provide an overview of the type of data collected, some of the challenges in using social care records in Portsmouth to collect data and how that information can be used. Data such as this does have many uses. For example, the graph that we put in on trends that we see with residents needing long-term support. That's the graph on page 7. That informs us of the resources we need to try to develop in Portsmouth to be able to meet those needs. For example, planning in the future years for extra care facilities, consistent, stable domiciliary care with companies that are established in the market. Those are just a couple of examples of using that data. This very much links to the next report in this briefing, which provides more detailed data about Portsmouth and shows how we assess the delivery of our statutory social care functions. We had a query earlier about the recording of ethnicity in one of the tables in the report. And it's worth clarifying, at the moment, it isn't mandatory for individual residents to declare their ethnicity, although it is seen as a protected characteristic in law. And the options for recording are refused, where someone who says they don't want to disclose, or undeclared unknown, in addition to those other sections where people identify themselves as a particular ethnicity. Where it's undeclared or unknown, the ethnicity is not volunteered or a worker does not know. An unknown can happen when records are set up in a reactive way or responding to a crisis situation if that information isn't recorded. It's an area that we want to do some further work on because there's a significant number of people that are recorded as undeclared or unknown, so we need to think about the quality of our data cleansing, our recording practice. And there is a caveat to that. We do have limitations in our current case record system, as we've highlighted in the report, but it's something that we want to focus on so we can improve the accuracy of that data. Hopefully that's provided a summary of the report. Happy to take any questions.
Thanks, Andy. Graham, any questions or comments? No. Thanks. Yeah, thanks, Andy. And I think this is just important to give an idea of how we sort of put these things together. As you say, we're going to be looking at things next, and that final point you mentioned, because it came up in our briefing, was about the unknown and about ways, because I think we discussed, didn't we? It was sometimes it might be in terms of the practitioners maybe not knowing how to ask the question or feeling like it's not appropriate. So at different times, and having worked in a service where when we were working contracted to the NHS, and we know that a lot of the NHS staff were not asking that question because they felt it was inappropriate, but then they started asking, making sure that we were doing it. And actually we had long conversations about how best to ask those questions and when the right time is, because sometimes, as you said, if it's in a crisis situation, that isn't the time to ask it, but when you get the opportunity, you can then ask it at a better time. And a lot of people are more happy than expected, but you always get some people who say, I don't want to tell you. So yeah, I think it's one way. I think as you say, with a bit of data cleansing, with a bit of moving through, thinking about how to ask, and because literally, I know some practitioners really don't want to ask that question at all because they think it's too intrusive. But at the same time, if we're trying to capture who we're working with in the city and who we're not working with, then it is a really important thing. And that also goes for other things like data around sexual orientation, etc., because that I know that that can be a real. You can find out that way that you're missing out on a huge chunk of the not a huge, but a certain part of the population and it's about how you can better engage with that. So I think that it's a good report about what we do, and I think, as I always do when we have these interesting things, is just the charts, the figure at the bottom of 6, which is about the trends in long-term support over time, which for anyone looking at the reports, we've got older adults is just going up, and that will just keep going up because we are now in the start of the baby boomer spike, which will go on for quite a few years. But it will go on for quite a few years, and so we just are cognizant that this is that is our graph. We've talked about it before, graph of doom, and that is covering everywhere in the country. We know this is going on, so that just shows that for all this talk about what we're saying is that the costs will continue to rise and rise and rise, and this data just shows that very, very starkly. So it's a useful thing, but it's also something that's quite terrifying. And no matter where we are in the country, this is what we see, and this is what we have to deal with. So thank you very much. Happy to note that, and then straight into the connected reports. Item 6, adult social care, use of resources. Andy.
Thank you. So again, being directed by our strategy, one of the activities in our strategy is managing our finance budgets and savings, and this report aims to support understanding of a detailed report that influences how adult social care in Portsmouth manages its resources. So in section 5 and 6, overall, Portsmouth adult social care represents a cost-efficient service compared to national, regional and comparative measures. The increasing average spend per person in Portsmouth is comparative with other areas in that there is a growing complexity of need, as we've just highlighted, and it takes more care and support, therefore, to meet people's needs. In section 7, whilst we spend more on longer term support for older adults, the active approach we're pursuing in prevention and reablement, which we've talked about today, is aimed to try and reduce this. By supporting our residents to be more independent for longer, this achieves a positive outcome for individuals, but it also enables us to spend less on longer term support, either through delaying the time that somebody needs more longer term support, or indeed avoiding it altogether. Section 7 also shows the effect that planning for facilities such as supported living instead of residential care for working age adults has enabled the service to promote independence and manage costs, and that's particularly for our residents with a learning disability. In section 8, we set out the picture for increasing requests for support in Portsmouth and the combination of factors that are likely to be behind that, from an effect of the pandemic to closure of other services. The value of preventative services and having an effective front door to services is clear in being able to support residents but continuing to manage within the resources allocated to adult social care by the council. We've recently started a piece of work that we've commented on earlier to review how our front door to adult social care operates in Portsmouth, and that'll be in conjunction with the work that we've talked about in terms of our digital accessibility. In section 9, in addition to the work across the council on healthier living and activity, we're aiming to address the higher number of care home placements in Portsmouth through greater access to services that support independence, such as extra care and reablement. The work on more of our residents using a direct payment, micro-provision we've talked about this afternoon, to manage their care and support needs is one of our improvement plan priorities and is an active project as it stands currently. We're working in several areas to promote and increase the uptake of direct payments, linked to another significant project that we've talked about this afternoon, which is strength-based working. Section 9 also demonstrates a point in the previous report that data can sometimes help us understand where we have inaccuracies in our recording and take action to put this right, as is in the case of residents with a learning disability living independently. In sections 10 and 11, these provide further evidence of how we use data. The relatively higher price for support in Portsmouth supports the use of changes to how we purchase care, taking a wider view of places and prices of care available. In section 11 particularly, we can see the income received from the NHS both through the Better Care Fund arrangements and through other income, which supports the adult social care budget. So, as we say in section 12, hopefully this report has just demonstrated a detailed approach to data, understanding where improvements are needed and how adult social care approaches some of those improvement areas. We did have a query which proved that our members do read our reports, even the appendices when we were in the briefing about short-term spend for working age adults. So we've done some digging around that to come up with a broad view to answer that point. Working age adults 18 to 64 are a greater proportion of our population, 65% compared with 60% in the All England numbers. And our use of direct payments is also lower, which could have an impact on that spend, that short-term spend, as direct payments can be used more creatively or cost-effectively for our residents. That's why we're trying to work to increase them. We've recently reviewed our policy on transport, and we now charge in certain circumstances, bringing us into line with other councils. That would affect people aged 18 to 64 more, but will also bring equity across all age and customers groups, but would only apply where short-term church services are chargeable and to chargeable services. Where domiciliary care is commissioned for short-term services, the hourly rate is above the mean for England and the nearest statutory neighbours, and we are aiming to re-tender domiciliary care services during 2026. With the previous data, which was called SALT, short and long-term care, the data was submitted at a gross level from councils. What that means is that we interpreted and submitted our data, whereas with client level data, that's submitted at a client level, so an individual level, and isn't aggregated up, it's submitted directly, as we've covered in an earlier report. There are some anomalies in what we're seeing shown back currently, but we believe over time that with the more accurate reporting at an individual level, we should see some more consistency in reporting. And we hypothesise at the moment that that will bring our costs more into line with England average and peer group. So hopefully that gives some context to those numbers around working age adults. And we would imagine when we bring this report back to you next year, if it's still in the same format, which we think it will be in broad terms, that we should see some changes in that. Hopefully that's helpful context. Thank you.
Thank you, Andy. Graham.
I did have another question in relation to paragraph 8, excuse me, about demand and access. It talks about the number of requests rising sharply between 2021 and 2023-24. And it says, despite this increase, 58% of requests resulted in no services being provided. Is that 58% of requests from the period 2021 to 2023-24, or only the last year? And then depending on that, I might want to ask a supplementary question.
I think that data's in the last year.
My supplementary is, have we done any more sort of deep dive into the request to try and see what sorts of things are being requested and being refused, in a sense, so we can get a better handle on whether it is an issue about gaps in service or whether it is people, you know, not really understanding what they can get?
Yeah, there's several pieces of work. I mean, what we're talking about, I think, is unmet need. We probably see that as a shorthand for requests that have been made but hadn't been acquiesced to or granted. There's several outcomes that are possible. One of those might be advice and information. It might be a service that we don't provide, but we know someone that does. It might equally be we could come up with something that could support someone to meet their own needs rather than have to have a funded service. I think what it really speaks to is the work that we're doing that I spoke to earlier around our front door to get a better handle on the data of what we're seeing people request and then what the outcome or the result of that is. We know, for example, that I think it's around about 75% of the work that comes in through our front door doesn't then get referred onward for an onward service. We meet that need there and then. But we need to be more precise around what people are asking for and then understand whether there's something we need to change about our offer. I think that's also linked to the new client record system. As we know, we've spoken about before, system one that we use currently is what they call an unstructured data system. So the reporting we can take from it, just out of the input into it, so people type it away, is limited. Whereas with a new client record system that we're aiming to procure, we'll see a much greater text and contextual depth of that data and be able to respond more effectively, I think. But I think broadly it speaks to the work we're trying to do around our front door, understanding the requests that are being made, how we respond to them, whether there's other channels we can direct people down and that sort of thing. So I think it's probably work in progress, I would say.
Thanks, Graham, and thanks, Andy. I think having had our graph of doom, we've got our other graph of doom on here, which is of course the one in section. Hang on, let me get it right. Section 6, which is of course our social care spend per adult, which again just goes up year on year. So from £379.41 in 2019-20 to £545.06 in 23-24, and of course if we went on to 24-25 it'd be more, and it will be more again in this financial year, which just goes to show costs are going up and demand's going up. So this just shows again why it's important that we are able to get the data that we have, but also that this is how we have to take into account our use of resources. Just a question about the brokerage scheme that we've been doing in terms of that. So for both Emma and Andy, just sort of go into that a bit more, and what's been going on with that over the last few months.
So we were in a position up until the spring of this year whereby we were seeking placements individually for people as they came up. The social worker themselves was negotiating with the provider and arranging that placement. We felt that we needed something that was more consistent, whereby we could understand our spend on certain providers, and whereby we were clear around the offer that we're obliged to give. So there's something called choice of accommodation, which is additional guidance to the Care Act, whereby we talk to people about if somebody needs, for example, a residential care placement, where is the place that is broadly in line with what we'd expect to pay for that residential care placement. The brokerage system puts out needs of that individual, the needs we're looking to be met, and then providers come back to us and say whether they can meet that need and the cost they can meet that need for. It's relatively early on because we'd want ideally between 12 and 18 months data, and we aren't there yet. But we think that's driven a consistency in our costs, a consistency in our purchasing, and we're still meeting need and offering a reasonable choice of accommodation to people. And so broadly, brokerage is an interim step between an assessment of need and identifying the needs that we're after to be met for that person in conjunction with them and their family, and the purchase of a service to meet that need. And it applies specifically to residential and nursing care.
Thank you. And I think we have our monthly finance updates from Emma and her team, and that just seems to be making a real difference, which is really positive. And that fits in. Obviously, we got that rising demand, so anything we can do to suppress the costs as much as possible, not by screwing anyone over, but obviously by having the tools available to make sure that we get best value is really important. And then obviously that fits in with sort of the key considerations of councils that Andy mentioned, which is 12. So it's about rising demand. It's about the high unit cost we've got, so we're trying to get that down as much as we can, because that's relative to all the councils for 65 plus. Low takeable direct payments, which again, and that comes in with the microfinance scheme as well, which is really important, because if we create more of a market there, more direct payments can take place, and therefore, because that gives people more control over their own budgets, because that's personal budgets. And then need to focus on community-based solutions, which I think fits in very much with our second paper today. So actually today we've had actually in many ways 4 very complementary papers, which though they're all for noting, they all are actually all very important and actually all fit together in terms of if we're keeping people quite happy, that means that we can better prevent things and intervene, and that shows that we're able to prevent things from going too far and work on prevention. That we know who it is we're dealing with, and then obviously we can best see by this data, we can see how we can best provide, best allocate our resources to get best value of money for the people of the city, who don't need, well, obviously all the people of the city, but that includes all those people who don't need adult social care, and that they can know that their money is going to good use rather than being unnecessarily wasted or otherwise or spent on too expensive placements and being reactive rather than proactive, which is what's really important. So again, this is something that we have to keep a very close eye on, and say to anyone watching, it's something that we, not just myself as cabinet member, but all of us as spokespeople, sort of assess this every month. We have that update, and we're able to obviously challenge and ask the questions then, and obviously within conversations between myself and Andy and Emma and the team, and also Chris Ward, our head of finance as well. It's all about sort of making sure we're always looking for those opportunities, but the most point is to try and make sure that we can provide services to people, and because the last thing we want to do is cut services. So it's about making sure we can be as efficient as possible is such an important thing, and that's why our use of resources, how we do that, is so good. And I'd like to thank all through this report, it's John, isn't it? Yes, John, with quality and performance, but I'd like to thank all of the senior team in adult social care, because their professionalism is why we are in such a relatively good state compared to other authorities, and working again across the authority with Emma and her finance team, with the head of finance, but also with other parts of the council and with partners outside. That is how we get to this situation. But as we can see, there's still things we can try to do even better. And again, this is not we're doing amazing, we're off. It's we're doing quite well, but we know there's places where we could do better, where we could be more efficient, where we could get more value for money, but not at the cost of care for people, and certainly not at the cost of services. So very happy to note that report. Look forward, as I say, all of these will have updates in the future. And of course, as Andy mentioned, and we've previously gone over, looking at, as we allocated money in the budgets back in at the start of the year, looking at a new client data system, which will actually help us more going into the future, and making sure that we can sort of get reports out and indeed be more efficient by not having to do workarounds. So happy to note that report, and that concludes the meeting. Thank you very much, everyone.